Welcome to Healing Your Life with Oriental Medicine with Anita Brown. It's a place where you'll hear about the alternative healing methods to improve your mind, body, and emotional well-being.
Hi, welcome to Healing Your Life with Oriental Medicine with Anita Brown. That's Anita Brown. I'm Suzanne, Lynn. She lets me just come and hang out and ask questions about acupuncture and herbal medicine, and I get to learn a lot of stuff. So I'm glad that you're here.
My pleasure.
Yeah, so the topic we're going to talk about today is what to expect as a first-time patient before, during, and after your first appointment. And, I've been honest with you. Up until I threw my back out, I was like, I don't know if it's acupuncture stuff. But man, when you're in pain, being stuck by needles sounds perfectly fine and normal, And I've got a whole show on this that we did, and
Right.
It was just miraculous change. But leading up to someone's first appointment, what are some of the questions that you get? What are some of the hesitations? And it's a brand new area for a lot of people.
It is a brand new area for people, and people are afraid of needles. Mm-hmm. So the first question is, I'm afraid of needles. Do they hurt?
Right.
And I can always tell people there are some sensitivities, but they don't hurt.
Right.
Needles are very thin, and people almost melt after their needle. They get so relaxed that they just kind of melt into the table and zone out. A lot of people call it, I guess a drunken feeling, euphoria.
I would say that. Is that the adrenaline that's being released?
It is the adrenaline, yeah, and your body is just releasing all that stress, and it's, being distributed and kind of metabolized and worked through the body, eliminated.
I can vouch for that because after every session I had with you, you'd be like, okay, you're done. Please leave. Time to go.
Rent the table for a half hour.
And I would just lay there, it felt like after a massage, I don't know if I can move. Not because of pain, you're just so relaxed.
Yes.
And I didn't expect that. I thought it'd be like, okay, I got needles, I'm out of here. But it's not like that. It's a very relaxing, almost drunken stage.
Yes, yes.
So the first concern with people, needles. What about some other questions that they're asking? If they're coming in with pain, are they wondering what kind of time frame, what can I expect as far as healing?
Yeah, the time frame, it always depends on the individual and how they respond to acupuncture and how long they've been in pain. Mm-hmm. But most of the time, they see a result within 24 hours. And it's almost like that miraculous time frame. 24 hours hits and then they feel better. Sometimes they don't feel as good initially after treatment, but then they'll go home and it almost makes them want to go to bed and sleep it off. Mm-hmm. And they'll wake up and they don't know where all the energy is coming from.
Wow.
So that's, that's a positive, and I guess I attribute that to the treatment.
Absolutely. What would be something that you couldn't treat? If someone called and they said, listen, this is happening. Is this something that you can help me with? Because I don't think that I can think of one instance besides, I have gray hair. Can you help me with that? Well, you probably can't turn it back to the regular color, or I'd like to be 5 inches taller, or something like that. But when it comes to pain and stress, toothaches, there's nothing that I've heard you talk about that you can't kind of take care of.
Yeah, there is nothing. It is a complete medicine. I've had people, of course, they come in for back pain.
Right.
And then I ask them the full questionnaire and health history of what other issues they have that might be making them more susceptible to back pain, some weakness in the system, maybe poor digestion because they're not getting enough nutrients to deposit proper bone. So, when it's all said and done, I've asked them about their digestion, and then they leave the facility, they always ask, oh, can we work on digestion?
Yeah.
And I didn't know you did that.
Yeah.
And so it's very profound for people. So it's one-stop shopping with acupuncture.
Yeah.
It helps. And I actually have a formula for restoring hair color.
Are you serious?
Yes.
Oh my gosh, that's hysterical.
It's called, and there's a formula with an herb, and it's called Mr. Ho's Black Hair.
Oh my gosh.
So premature graying can be slowed down.
Mic dropped. I thought that was the craziest thing. There was no way you could touch that. Ooh, all right, let me take a break on that, and we're going to come back about post first time treatments and what to expect. So hang on.
Anita Brown Acupuncture and Herbal Medicine is all about healing your mind, body, and emotional well-being with traditional Chinese medicine, or TCM. From chronic and acute pain to arthritis, IBS, digestive health, inflammation-related autoimmune conditions, insomnia, colitis, depression and neuropathy, and even infertility, TCM can treat a variety of symptoms and more. And the hundreds of herbs Anita is educated in not only treat symptoms, but boost nutrition in the body. If you're tired of being in pain and feel like you've tried everything, this is the time to call Anita Brown Acupuncture and Herbal Medicine and find out more about the healing ways of acupuncture and herbal medicine. Easy telehealth options are even available. Call Anita today at 352-231-2000.
Welcome back to the show, Healing Your Life with Oriental Medicine with Anita Brown and Suzanne Lynn. And we were going to move on to what happens after a patient's first time visit. But during the break, we were visiting about a topic we were discussing in the first segment about graying hair. And I thought it was crazy. There's no way that you would be able to do anything about graying hair. And you're like, actually, there is a formula. Can you talk about that?
Yeah, there is a formula for graying hair, or prematurely graying hair, and the formula is based on the premise that people that have premature graying hair are losing their essence prematurely. So they're aging quicker than they should.
Okay.
So this formula reestablishes the kidney energy, the constitutional energy of the body, and will actually slow down the graying of the hair. And I have seen it in some patients restore a little bit of their natural color.
Wow.
I
mean, it's all connected, isn't it?
It is all connected. And a lot of times premature graying or the severe graying of hair is attributed to stress. We know that.
Oh, sure.
So Chinese medicine directly treats stress. So that's one of the,
Makes sense.
That's the crux of it.
So someone comes in, they do the acupuncture. What can they expect after they leave? I mean, is there going to be soreness? Do they need to drink a lot of water like after a massage? Like, what are some of the things that you let people know to expect?
I tell them to, if they feel vibrant after they leave, to store that energy in their savings account. Because they need that to go to their essence or their constitutional energy, which will stop that premature graying hair and really slow down the metabolic process that, ages the system and breaks down the tissues.
So how do they do that?
They do that by, if you're best to have an acupuncture treatment probably in the evening or early morning or on a day that you have off, or you can just kind of take it easy.
Okay.
But I know some people just, after acupuncture treatment, they feel so good, they just hit it and get it, with no stopping. And they usually are fine, but some people have one of those reactions to acupuncture where it just makes them feel exhausted.
Wow.
So
it's the release.
It's the release, so they need to rest.
I can only relate to kind of having massage where they say, you got to drink a lot of water and drink Gatorade to replenish. Like, what's happening when these toxins are being released? What do you need to do and know?
Well, Chinese, they are proponents on not drinking too many fluids, because drinking too many fluids actually severely deplete the kidneys' energies. So you're drowning the kidneys.
Okay.
So drink if you're thirsty. If you're not thirsty, don't drink. Drink filtered water, of course.
Right. Nothing
that's going to have sugar in it or any artificial ingredients.
Right.
Just a good water or green tea.
That's good. What's different about green tea than the regular tea? Is that
it's
flushing?
And it's very high in antioxidants. So yes, it is flushing. It actually scavenges free radicals, and then you will eliminate those. So yeah, it's very stabilizing for the body and helps replenish the nutrient balance or the pH balance.
Where were you 25 years ago? I needed all this a long time ago.
I should have started earlier as well.
I love it. This is great information. All right, well, we're going to come back with additional shows. We hope that you'll subscribe and like, and most importantly, share the information that you're getting. You know, don't save it for yourself. If you've got friends that are maybe experiencing pain or, you know, all the things like gray hair, we now know that can be tackled.
Wrinkles, dry skin, whatever it is, diabetes.
Wow. And you know,
spectrum.
The shows are going out. Anita's getting busy, but give her a call. I mean, you're open to taking phone calls, answering questions. There's no stupid question.
Exactly.
And if there is, she says, I'll let you know, but I won't tell them. So, no, I'm just kidding.
I love questions. Questions are great.
Yeah. All right. Well, we'll come back with the next episode. Thanks for joining us.
Thank you for joining us for this episode of Healing Your Life with Oriental Medicine with Anita Brown. Please feel free to call her with questions that you may have at 352-231-2000 or visit her website at www.anitabrown.acupuncture.com. We're thrilled to be able to share stories and insight as to how alternative Chinese medicine may help improve your life and decrease chronic physical and emotional pain. And please be sure to subscribe to this channel so you don't miss a single episode. Individual results may vary, and our advice is not a substitute for medical advice from a physician. Please consult a physician before making any changes or adding to what has already been put in place for you.